Ladies and gentlemen, we are here live with Dr. Olli Sovijärvi, who has just come off the stage from his talk, where he has been presenting his venture, HealthDx. And what can you tell us about HealthDx? What's it all about?
Yeah, it was a nice presentation and some interaction also with people. And HealthDx is actually a project that's been running about 3 years already. And what we have created are laboratory packages with some detailed information and also an online course. But now what we have been working for to really create a digital platform, kind of like an online preventive health clinic, is now the release of the HealthDx app.
Okay.
And that is something that is going to be growing into a holistic health, preventive health clinic. So you're going to have there eventually, you can input your data from different trackers, also as it now from different lab results, and all genetic data, epigenetic data, and whatnot. The sky is the limit for that. But at the moment, the idea of the app is that you can input any marker you want, or actually at this time there are 50 markers, but it's
50?
going to be 50.
Yep.
But it's going to be growing, and you can input these markers, and you get personalized recommendations based on your results. It's not just okay, this is out of reference rates, and then what? But you actually get really detailed information on what you should do about it, and it's taken into account different other markers and their relationships to each other. And there are different physiological groups. So for example, there is a measurement for silent information, but it sees like different markers, like hCRP, leukocytes, thrombocytes, and so on. And based on these, you will get like layered information and layered recommendations. And the deeper you go into the app. So
Amazing.
That's the basic idea.
Amazing. Okay, so it's kind of like your, analytics for your systems, for your human systems.
Yeah.
Now, what are the inputs? What are the input sources for the data?
Either you can get from the HealthDx laboratory packages. So if you have done these in Finland, you will get automatically your results into the app. So you don't have to do anything. But you can use any laboratory you want, but you have to input your own results by hand. But there's conversions for different kind of units, so you don't have to get confused with these. And it's very easy and very helpful for you to do this. And once you have at least 10 markers in there, there will be calculated this resilience, HealthDx resilience index.
Okay.
And this is based on the different markers and their relative weight to each other and their importance. For example, the top category is silent inflammation, because we know that silent inflammation is the leading cause behind most of the chronic diseases. For example, heart disease, cardiovascular diseases, neurodegenerative disease, and so on. And the more markers you have, the better picture the index will give you. And it's from like 0% to 99%. Nobody gets 100% because that is virtually impossible.
There's no perfect score.
Yeah.
Okay. And you've designed these kinds of markers or protocols?
Yeah. We have designed the index and the protocol, and the markers are of course universal, like hCRP for inflammation and cholesterol values and so on. So they're universal, so you can use it from anywhere you are in the world.
And so natively it plugs into the HealthDx diagnostics offer, which is here in Finland.
Yeah.
If you're coming from abroad, you can put your own data in.
Yes.
It's still useful as an information platform.
Definitely, yeah. It is designed to be useful whether you're in Spain or Finland or Uruguay or wherever.
And so what it's working with blood work.
Yeah, at the moment it's only working with the blood work. So this is the beta version.
Okay.
The app is now in the beta version.
Yeah.
It is free to use.
Yeah.
But eventually, if you want to get more detailed insights and track your results, or get consultation, or an online course, then it's like a monthly fee. But now we invite as much beta users as possible.
So it's on a promotional offer?
Yes.
Okay.
Yeah.
What is it?
What is what?
What's the promotional offer?
Free.
Free. Oh,
Yes.
okay, nice.
The app is free at the moment.
Okay,
Yeah.
okay, and it will turn into a membership model.
Yeah.
Soon.
Yeah. So
Okay,
that's the plan. So it's kind of like you have a coach, you have a kind of like a doctor in your pockets.
Yeah.
And the intelligence is actually my brain in there.
Yeah.
So it's not plugged into Neuralink or anything like that.
The AI.
AI Sovijärvi, hello.
I'll be back.
No, get down, chopper now. No, what I mean is that the individual recommendations for, let's say, optimal values or out of reference values are done by myself.
Yep.
And they are based on 100% on research.
Yes.
And what the research says.
And you've been studying this stuff for the last 7 years plus
15 years.
15 years. Sorry,
Yeah.
15 years. Yeah.
Yeah, so I can share my knowledge and also the experience with the patients. So this is kind of like creating this monumental platform to really like replicate the job that the doctor usually does, for example, at the office.
Or should be doing.
It should be doing.
Yeah.
That's actually better said.
Yeah.
Of course, you're not getting any prescriptions here. This is for preventive health.
Correct.
If you have
What gets measured gets managed.
yeah.
Yeah.
Peter Trucker, yeah,
Nice.
that's very nice. Of course, if you have like really out of range reference no markers, there is a suggestion. Okay, go to see your
Go
doctor,
see your
like
doctor
immediately.
Yeah.
So I've been really careful with this. That
Yes.
if the results are some kind of alarming, there is always a recommendation. Go to see your physician. So
Yeah.
and that's just to make sure that the people gets the best treatment also.
Amazing. Okay, so in wrapping up, thank you very much for sharing this amazing platform, product, etc. If you wanted to leave the audience with one most important, most valuable, most powerful idea, what would it be?
Stay in tuned to yourself and feel and see what's best for you. Do not necessarily listen to like everybody else around you, but try it, what works for you, and then compare it to your quantitative data. And then you can learn really much about yourself. So you have the objective data and the subjective experience, and combining these is the way to go.
Beautiful, beautiful. Thank you again. And is there a call to action? Download the app?
Yeah,
Is it in the
download
App
the app.
Store? Play
It
Store,
is.
App Store, HealthDx, Health Space DX?
At least in the App Store. I think it's coming to also for Android very soon. So.
Okay. Thank you.